Hello, good afternoon, everyone. Thanks for joining us for today's webinar session on the latest from CMS, the Pricing Transparency Mandate Delay, and how to respond. It's just about 1 o'clock here Eastern Time, and it looks like most people have signed in, so we're going to go ahead and get started with today's session. Just some brief introductions before we get started. I'm Brad Josephson. I'm the Director of Marketing here at PMMC. And today's speakers are Greg Kay, Senior Vice President of Revenue Strategy here at PMMC, as well as Tara Bogart, also Vice President of Revenue Strategy. Greg and Tara both have a lot of experience in healthcare and with PMMC, and especially around this particular topic around the price transparency mandate. Today's session is 30 minutes. We should have some time for questions at the end. So if you have any questions that you think of during the presentation, please go ahead and enter those in the questions tab, and we will try to get to those at the end of the session. And so with that, I'm going to go ahead and turn it over to Greg.
Great. Thanks, Brad. Thanks, everyone, for your time here midday today. So we thought we would start with the news. Obviously, a lot's been written about the final OPPS rules that were published this past Friday. And when the home health rules were published on Thursday of last week, it was a good indication that the OPPS rules would really quickly follow. As noted in Becker's, nearly everything moved forward from the comment period to the final as initially outlined. The 340B reduction remained, the site neutral payment remained, even though CMS did lose that in an initial suit. It's still working through the appeal process. They did elect to move forward with the rules as written. I think the key thing and what we'll be touching on here is the release final rules did not address pricing transparency.
Okay, and Axios weighed in too, and their take was really that hospitals dodged the bullet. It leaned a little more political, and it had the undertone that Trump lost again. But then the Healthcare Dive published an article. The headline is that transparency was put on ice. So a few things to keep in mind. You know, ice is used to preserve something, and eventually ice falls.
Another piece of news that was published just in the last couple of days, and it just kind of really points to the fact that while CMS did hold on their release of the final pricing transparency rules, it's important to remember that this is an industry issue that's still moving forward on various levels. As was noted in this particular Becker's article, they highlighted the fact that states such as Florida are still moving forward with specific initiatives. In Florida, they're launching an updated version of their statewide pricing comparison tool and are increasing the number of comparative services that are going to be available through that tool. They're also incorporating a recognition award to those that are leading the way with proactive pricing transparency measures. So while CMS may have delayed things, things are changing, things are still moving forward. Is a quick summary of some of the components that have been in the news here lately. The late surge of comments seems to be a real key factor with CMS's decision to delay the full and really allow time for more of a full review and vetting of all comments. On several of our webinars, we've noted over the last couple of weeks that on the 27th, there were over 1,000 comments that were posted, and at the time, largely in favor of the requirement moving forward. These were consumers that were all in favor, consumer advocacy groups that were in favor of the mandate. If we look at between really 9/27 and 10/4, the additional time it took for CMS to both review and post all of the communications that did come in, that number increased to nearly 4,000 with healthcare providers really including more comments. And healthcare providers, if you go back and review the website, really submitted a lot of in-depth letters, a lot of specific proposals, specific suggestions, such as exempting those that had already deployed a self-service estimate tool kind of an example of some of the things that were out there. One of the most common noted concerns from our industry really related to the requirement to provide what CMS defined as the new definition, being the negotiated charge. And I think everyone really kind of honed in on the fact that was a new requirement, certainly was confusing, would potentially require a substantial amount of work to both create and maintain. And more importantly, there was very little guidance with how to create such a value when reimbursement is, as we know, at a claim level. It has to be somehow allocated down to a detailed charge code level. And you know, the hospital's responses often had very specific and rational reasons why this was a mandate that was challenging.
So while the current draft might not be the ideal requirement of what to post, and we might believe it's confusing information, it's going to require a lot of work to do at the end of the day, and consumers would rather have too much detailed information versus little to none. So based on our review of the comments, there doesn't appear to be a compelling reason for CMS to delay the pricing transparency mandate to put the patient first. So SEMA Verma tweeted, I believe it was on Friday, and basically said that they're committed to implementing the order, and they are taking the comments into the decision on what the final will look like. So we believe that CMS is committed to this, and our session today is to really focus on how to best use this interim time while they come up with the new rule. So at this point, when CMS has delayed the final rules and they haven't been canceled, it will likely be challenging. The larger question is, do you believe pricing transparency is needed, and will it happen at your organization? Every hospital has a binary decision to make. Is it going to happen or not? So what we're looking at here on screen is that about 66% don't buy in, don't believe the rule will be finalized. A large majority believes a court challenge is likely. And on the flip side, you do see that about 37% buy in on building price transparency tools. So that might not be what was proposed, but they do believe in price transparency and are going to move forward. So if you've been on our webinars before, we've said, you know, that hope is not a plan. A lot of people were hoping that this was going to go away. We don't believe it's going to go away. We just believe it's going to stay and just be tweaked a little bit.
Yeah, that's a great point, Tara. We certainly are seeing a mixed response over the last 3-4 months since the initial executive order pricing transparency mandate. Some healthcare providers, even after the delay on Friday, have indicated that they're committed to moving forward with increased pricing transparency. A number of organizations have engaged PMMC or other consulting groups to actually go ahead and continue to move forward, creating the initial draft files in anticipation of this delay. We'll still be working towards a potential January 1 deadline. Other clients are reviewing their self-service estimate tools to ensure that CMS's list of 70 shoppable items are included. And other clients, other organizations are really still waiting to see what the hospital associations, what their leadership is really going to be providing in terms of guidance with where to move forward and how to move forward and when to move forward. So if your organization really believes pricing transparency is a larger trend that's occurring and consumers are going to want to take cost into consideration for certain services, not all, but at least scheduled services, we're suggesting specific tactical steps or tasks that you should consider doing on the call today. But really, to win going forward with pricing transparency, you're going to have to adapt, you're going to have to be strategic, and you're really going to have a plan that you work and you're willing to update that plan as you go forward in looking at and dealing with pricing transparency. So let's review some key steps that your organization should be taking now during this interim period as we're waiting on the final rule. And we're going to be reviewing a list of 6 steps that are based on material provided by HFMA. They provided a list of 5 key steps. And following the webinar, Brad will send out this particular slide deck and the HFMA list of 5 to-do items. Number 1 is pretty consistent, and that's to have a team, stay organized. Your team should really be built off of last year's team that you had in place in developing the initial CDM file that you've posted. Your core group should include the CFO, patient access, who often receives the frontline consumer questions. Your managed care department should be representative since they have and manage all the payer contracts. Obviously, compliance, with this being a new potential regulation that does have in the current draft form specific fines and repercussions. And obviously marketing, with this being a consumer-facing component, and the back office revenue cycle team should be included as well. Now, going forward, this team should continue to monitor CMS's website for updates. We do anticipate there being some follow-up updates along with FAQ documents in response to the current delay. Item 2, you should really hone in on and think about your shoppable items. Obviously, the market is changing, and you need to be thinking through how are you going to adapt to the changes. As I mentioned a moment ago, obviously not all healthcare services are shoppable, but services that are scheduled would be the ideal place to start. In terms of the third point, your team should be really taking this as an opportunity to review your current website and page location of your pricing information. CMS was very specific in the draft rules with accessibility to the information and the proposed requirements on a go-forward basis with the accessibility of information. It's important to remember that the information should not be hidden, should not be buried, but it's going to have to be displayed prominently on your site. The fourth point is your focus really shouldn't be about price alone. In the executive order, it called out being transparent for both price and quality data. As we all know, price plus quality equals value. So you should be incorporating key, relevant, public quality data in your website, or at least pointing to the quality metrics that you want to control. The fifth point to consider is really continue education, both with your frontline staff as well as just the entire leadership in the entire organization. From the letters that we, as an industry, submitted to CMS during the comment period, we made a strong, compelling case that this is a very complicated process. Prices vary by payer and plan. Some payers, such as Medicare and Medicaid, prices are set, whereas with commercial payers, there's a negotiation process that's often tied to volume. So there's some rationale with how prices are set, but we've communicated in our correspondences back to CMS that it's complicated, and consumers also noted in that comment period that it is complicated. We hear it every day, and we know that consumers just want to understand. So while it is complex, we can't just let it in there. We've got to be proactive in that education process, which means we need to ensure that we're starting at the top. We need to make sure that we're communicating with our board, our department leaders, all staff is aware of how pricing is set. We should be looking at internalizing and utilizing our organizational newsletters as an example. It's also a good time to be thinking through and being proactive with your local media. Obviously, your marketing team should have already met with them, knowing that this pricing transparency rule was headed towards a 1/1 date. Obviously, we want to continue to be proactive. We don't want to wait for the media to print a story and have to react. We want to be proactive there. And again, back to that patient communication, it all starts with our company organization website. So just make sure that your website is very easy to follow. Use your competitor websites, use other organizations' website as a guide or a catalyst for those internal discussions. And then lastly, really take the time to evaluate your current calculation tools, more specifically your contract management and your patient education or estimation process, if you will. As we go forward, automation is going to be key with pricing transparency. Data from your CDM, from your payer contract calculation engine, your patient estimates, what's posted on your website, are going to have to move to be in alignment over the long run. You're not going to be able to maintain multiple different systems or manual processes. That alignment is really going to be key. It's also important to consider and incorporate with your tools as you're doing that evaluation, how you're going to potentially lower some or even all charges, and how you're going to model those charges through your actual payer contracts. All these things are going to have to be looked at, considered as you go forward. And now's a good time to really evaluate and understand what capabilities your current tools really provide from an analytical standpoint.
Okay, so let's go over a couple things that are non-controversial. So with regard to the accessibility to information, Greg touched on, I think it was point 3. And in the proposed rule, CMS provided additional guidance with where and how the information needs to be made available. Remember last year when the mandate first came out at the poster CDM, there were all these questions on what exactly had to be posted, and they had to come back with clarifying FAQs. In the proposed rule this year, it says it can't be hidden or buried on your website, but it needs to be displayed prominently. Can't have various requirements to get the data, and it needs to be easily found and easily accessed. Regardless of how things play out with the final rules and the lawsuits, I think everyone's resolved the fact that the ACA is requiring us, posting your charge items. Earlier this year, most hospitals posted the list, but it was a bare minimum with their data elements. So it's just a CDM file description and that price. So in the draft rules, CMS provided additional guidance to really put the patient first and make the data useful and comparable. So it now includes the code, description, HCPCS or CPT, your revenue codes, and some other information like an NDC or modifier. And for multi-facility organizations, the prices have to be facility specific. So CMS's reference to having the DRG code linked to the CDM file and negotiated charge for all contracted payers and plans is definitely a more questionable item. So these two might be addressed in the final rule, but they're things you should be thinking about and have queued up with your team.
Yeah, so beyond the CDM file, and Tara makes a good point, we did last year as an industry just kind of go with the minimum requirement, and I think that's why CMS was very pointed, and there were a few negative comments around the accessibility of information and really the additional clarification data elements with the CDM file. The second file requirement in the draft rules was really the development of a list of shoppable items. And obviously, CMS provided a definition of what a shoppable item is, and it largely related to a service package, if you will, that can be scheduled in advance. And I think it's important to remember, regardless of whether this is a final rule requirement or it's incorporated into some type of future mandate for a self-service estimate tool, which was something that the American Hospital Association did note as a better path forward, was a requirement of providing and everyone deploying self-service estimate tools. It's going to be important to really understand your particular shoppable services and the comparable allowable value, which is a critical component to an accurate estimate. That shoppable service is also going to be really a critical analytical task that your team, if you're not on top of today, should be something that you're incorporating and bringing to the forefront with your pricing transparency team. Now, remember that CMS's comment related to the pause referenced the fact that they had received over 1,400 stakeholder comments in those last few days that were thought-provoking and included very innovative ideas during that comment period. Now, CMS also noted that they're going to be working to finalize the hospital pricing transparency rules alongside a comprehensive proposal for healthcare plan pricing transparency. So if you don't want your services to really be seen or even negotiated as a commodity, now's the time to really organize and have a plan to present your pricing, especially for shoppable services. And to create this file, the first step is really going to be to analyze your historical billing data to determine an ideal claim or patient scenario for everything you do. And once you have that, then determine, based upon those services, which shoppable items you want to post. Again, consumers want to understand, and it's going to really start with us converting data into something that's meaningful and understandable. Most of the comments for the delay, as I noted earlier, related to our process being complicated, which it is, but remember, this delay is not going to give us a pass forever. So now's the time to really begin analyzing this data and determine where you can get the information, how you can get the information. Your patient estimation system, your contract management platform, your decision support tool would probably be a good place to start in creating and analyzing that billing data to come up with your ideal patient scenarios. So as you identify your shoppable services and coming up with those ideal patient scenarios, it's going to be important to just remember you may still be required to have that detailed charge information. So it would be something you may or may not want to include. You may want to start with the detailed claim level information, but have that detailed charge data available. Just remember, this pause is just that. It is a pause. And as we know, things that are line level, where you've got one charge code that's billed as a claim, things like fee schedules for lab, radiology are very easy, but the expanded analysis of key inpatient and outpatient surgery services are really going to be where you need to start to look at and analyze your shoppable areas. A great place to start is going to be the list of 70 shoppable items that CMS provided. They outlined coming up with 300. You may not need to go that broad, but obviously 70 is a good place to start.
Okay, so it's important to recognize key processes that operate today as organizational silos, but in the future is really going to need to work together. Not just reporting to the same executive, but actually operating on an integrated platform. So an accurate allowable is the connecting component, and that is specifically where PMOC excels. Payer scorecards and financial reporting must integrate to really understand not just your denials and short pays, but how are collections with the patient, and how do we take that into consideration when we negotiate a contract and monitor actual to projected, and how do we adjust charges and reimbursement as the market, now being consumers, payers, advocacy groups, et cetera, as the market, really starts to understand and compare to others. So to really win going forward with price transparency, you just have to be ready to adapt. You have to be strategic and have the right tools and processes.
Right, you are, Tara. This delay has provided, I think, the entire industry, especially from CMS's standpoint, an opportunity to provide a better pricing transparency solution. It should not be seen by anyone in our industry as a waiver or something that's going to be put on hold forever. Obviously, pricing transparency started years ago with a concept that consumers needed to be more engaged in their medical decisions. The Affordable Care Act acted on that concept. The executive order is now forcing the issue to the forefront. And we anticipate the final rules to be out soon. Based upon Ms. Verma's comments, the hospital pricing rules will likely be addressed in the broader context of healthcare plan pricing transparency. Again, with the goal of making price and quality data more accessible and insight for consumers. We need to just be aware we've requested this delay and we provided a lot of detailed suggestions with what should be done. And we anticipate CMS acting on that in very short order.
Okay, so what we outlined today really are tactical steps or tasks that you need to do, but to really win going forward with pricing transparency, as I mentioned earlier, you have to be ready to adapt. You have to be strategic and have a plan to move forward. So what we recommend is a whiteboard session that starts defining what pricing transparency means to your organization. That includes all of the related departments and should be aligned from the executive team on down. So once you have that definition and everyone's in agreement, organizations can be identifying what outcomes you're expecting, and PMOC can help you accomplish this and then help you identify your current processes and gaps that lead to the KPIs that support whatever goals and objectives that you've defined. So this whiteboard session is complimentary. Greg and I have done a lot of these for organizations and helped them really get started on a pricing transparency strategy, and we would be happy to do that for your system as well.
Great. Thank you, Greg. Thank you, Tara, for the insight and the updates on where this is all going. We do have a little bit of time for some questions, and we've had a couple come in throughout the session. So if you wanted to ask something, go ahead and enter that question, and we will take it if we have some time. So, Greg, I have one for you. Is the proposed requirement to publish CPT and revenue code also on hold for now?
Yes, that's correct. The entire pricing transparency rules were put on hold for now. If you review the comments that were listed, there were very few comments. There were a few related to CPT codes, but there were very few comments related to that being a real large industry concern. We don't see that as being a controversial issue and likely something that CMS will be moving forward with in the final rules. Tara, any other thoughts with that other than it's on hold for now, but it's likely something that will be moving forward, especially looking at and based upon the limited comments that were there.
Agreed.
So when do we think the rule will be released?
Yeah, that's really the big unknown question right now. CMS has not put anything out definitive in terms of a time frame. Obviously, there are some that would project it out to be, as early as the next few weeks. Others have suggested, and there was an article in Modern Healthcare yesterday, that indicated it would be after the first of the year. I think most individuals, everything I've read or heard or spoken to, don't anticipate this going further than Q1. So sometime over the next 1 week to 3 months would probably be a reasonable time frame. Tara, have you read anything else beyond that latest yesterday in Modern Healthcare?
I haven't. I've had a couple conversations with clients, and we've discussed that, you know, potentially adding the kind of the easy pieces to the CDM, the extra detail that could still maybe come through January 1. But I think the other, you would have a little bit more time to get the other pieces in place if something different is announced.
And another, thanks, Greg. Thanks, Tara. Another similar question. Do you feel the deadline will still be January 1st, even with the delay in the finalized rule?
Yeah, I know in an email communication I had with CMS's pricing transparency team, they did indicate that the rules from the comment period should be considered final, or they will be effective, if you will, January 1, unless CMS publishes something to the contrary. I think there is a hope that because they released the other OPPS rules without speaking to pricing transparency, that it has been delayed. I think that is probably more of a hope than something specific. They've not indicated a wavering from the 1/1 date. They've only elected to move the other things forward without specifically addressing it. I think our hope is, like most in the industry, that this will be delayed for a short time, but we just don't know how long.
Thanks, Greg. Another question. While this new rule is on delay, are we still held to prior year's regulations?
Yes. The one that went into effect January 1 of 2019 was completely separate, so it still stands that your CDM file with your price and description needs to be there. So that will remain, even though we're not required to add additional pieces to it and do the other components.
All right, thank you, everyone. We're up on 30 minutes now, so I think we're going to go ahead and wrap up for today. I appreciate everybody's attendance on today's call. We will definitely be keeping everyone posted and up to date as we continue to learn more about the final rule and when that will be finalized and released. So thank you again, everyone, for attending, and thank you, Greg and Tara, for your insight today.
Thanks, Brad. Thanks, everyone.
Bye.